Dr. Anthony Fauci is telling the story of his life and his pivotal role in fighting the COVID pandemic, and pivotal is the word here. His more than 5-decade-long career in public service included 38 years as the nation's top infectious disease expert, working with 7 different presidents. He oversaw critical research into HIV, developed programs to fight AIDS, and lead the response to, listen to this, SARS, Ebola, and anthrax cases. His new memoir is titled On Call. This is a great title, A Doctor's Journey in Public Service. We're very happy to say that Dr. Anthony Fauci joins us live and in color here at the table. Good to see you, Dr. Fauci.
Thank you, Gayle. Good to be with you.
This is a perfect title for you, A Doctor's Journey in Public Service, because, boy, has it been a journey for you. I read your book over the weekend, and I love how you started it with Albert Bourla of Pfizer calling you to say, Tony, I think we have a vaccine, and I think it works. You said you literally sort of broke down and had a very emotional moment because you didn't think this would be possible that quickly.
No, I did not. I mean, this is historic in what was accomplished. 11 months, if this were 10, 15 years ago, this would have taken years and years. But the combination of the exquisite science that was put in both for the mRNA as well as for the actual immunogen or the business end of the vaccine was just amazing.
Because you were talking about you were on the front lines of AIDS, and at the time, Bill Clinton said, hopefully we'll have a vaccine in 10 years. And as you point out, we still don't have an AIDS vaccine, but yet we have this for COVID.
Yeah, it was an amazing scientific accomplishment, and also the amount of effort that was put in with Operation Warp Speed to get millions and millions of doses made before we even knew it worked. That was very, very helpful in getting it done so quickly.
Go ahead, Tony.
I was going to say, when we think about the response to the pandemic, Operation Warp Speed is clearly one of the success stories. And also the distribution of the vaccine, which happened very rapidly. As we get further from COVID, I think a lot of people are asking themselves, what did we learn and what will we do better the next time? And one clear area seems to be the school closures, which did enormous harm to kids on multiple levels and didn't seem to save lives. And I wonder, can we say today that that is a mistake, the closures?
I think what was not a mistake was the actual closure, because when we had to shut down that 15-day to flatten the curve, we were in a tsunami of cases. Right here in New York, you had freezer trucks in front of Elmhurst Hospital.
I remember the hospital outside my house. But I'm not talking about the initial.
No.
I'm not talking about the initial. I'm talking about the depth.
I'm going to get to that.
Okay.
And the issue is shutting down everything immediately. And we didn't shut it down completely, but essentially major social distancing in even schools was the right thing. How long you kept it was the problem, because there was a disparity throughout the country. I mean, if you go back and look at the YouTube, I kept on saying, close the bars, open the schools as quickly and as safely as you possibly can. But initially, to close it down was correct.
I'm not talking about initially.
Keeping it for a year was not a good idea.
So that was a mistake in retrospect. We will not repeat it.
Yeah, absolutely, yeah.
But I want to focus on the word journey in your title, because as you sit here today, you now have to travel with security. You, a public service officer who basically really has saved millions of lives, you have to travel with security today, because even though you haven't been in this job for 2 years, you are still a lightning rod, because people still, some of them doubt what you say, how you did it, and the way you did your job. When what you always say in the book is that you were guided by science always and telling the truth. And that still seems to have hurt you as we sit here today in 2024. I want to know how you navigate that.
Yeah, I mean, you have to stick with the science. I think what we've got to do a better job is to get the public to understand that science is a self-correcting process. Science is a process that allows you to gather information, data, and evidence. And in the time that you have to make a decision about a recommendation or a guideline, you use the information you have. If you're true to the scientific process, as new information comes the way it did, because clearly SARS and COVID was a moving target, then the scientific process will have you gather information and say, well, wait a minute, maybe this is the way it was in January and February, but this virus is different now, or we are dealing with new information that we didn't have before. That's get confused. People think that science doesn't know what they're doing. That's the problem.
Yeah, and for the American people, if we can't really grasp the science, we lean on our leadership.
Right.
And you spoke about your relationship and write about your complicated relationship with former President Donald Trump. he could possibly be our president again. Given that you know him personally, from a public health perspective, do you believe he is fit to lead us if he is elected president?
You know, I don't want to get into what's fit or not. That I want to
From
stay
a public
out of,
health perspective, though.
From a health standpoint, he missed opportunities to use the bully pulpit of the presidency to tell people to do things that would keep them safe. That's what bothers me as a public health person, as a physician, who my only care and goal is the safety and the protection of the American public and their health. And for example, he could have said when the masks came out and the CDC said, wear a mask, instead of saying, I don't want to wear a mask, he could have said, mask saves lives. Yeah. I'll wear a mask. And then all the people who follow him religiously would have been wearing masks. And it would have been the same thing.
Early on, you called him to say, look, Mr. President, this is serious. You have to be honest with the people and let them know how serious it is. And the very next day, Dr. Fauci, he's saying the whole thing is a hoax.
Yeah.
What did you think when you saw him say that after you had a very extensive conversation?
Intimate meeting with him.
Yes.
I was flabbergasted. It was like whiplash. Because when I was speaking to him, one-on-one saying, Mr. President, you've really got to be honest with people. It will come back to bite you if you don't. We have a real problem. And I actually was convinced that he agreed with me. And then I went home and I put the television on and he said it was a hoax.
Yeah. But he said that he loved you. He said that he loved you and he appreciated the work you did. But while he's screaming at you at the top of his lungs, you said it's very unnerving, even when you're right, to be screamed at by the President of the United States.
That is a fact.
Yeah. We have to go, but what about Biden? Do you believe he is fit to lead us for the next 4 years?
Absolutely. Absolutely. Because the first thing he did when I became his chief medical advisor, we had a conversation literally the first day saying we want to go with the evidence and the truth. And if we make a mistake, we correct it. But we've got to be honest with what's going on. Yeah. That was his first words to me.
But now people blame you for COVID. There's some conspiracy that, you're working behind the scenes, that there was a lab in China that you're responsible for. As we sit here today, we still don't know the origin of COVID.
No, we don't.
And it certainly didn't come from anything that you've done or did not do.
I mean, that's for sure, because the viruses that were funded by the NIH were so distant from an origin standpoint, or we call it phylogeny, or evolutionarily.
We don't know what that means.
That's right. It's so different from SARS that it couldn't possibly have turned into SARS.
I mean, there's a researcher named Alina Chan who is affiliated with MIT and Harvard, who's a little fuzzier on the
but she's
COVID.
a pretty fuzzy person, quite frankly, when it comes to that.
All right. Well, the New York Times published her op-ed.
I'm surprised that the Times wrote that. Yeah.
So you don't agree that the most likely scenario?
No, I think for anybody to say it's most likely, right now we have to keep an open mind. If you look at the virologists, the overwhelming number of virologists in the country, they feel that the evidence, though not convincing, is more suggestive of it being a natural origin, though not a slam dunk.
Dr. Fauci, we appreciate you. Thank you so much for joining us. We got to get to this commercial break.
And thank you for saving lives, Dr. Fauci.
Thank you.
Thank you for saving lives.
Your doctor's journey in public service is available today. We will be right back.